Good afternoon, everybody. Again, this is Mark Epp with 318 Insurance, and just wanted to come to you with a little something a little bit more urgent than some of the other more general videos that we've done. Um, if any of y'all are familiar with Medicare, you know that Medicare goes through changes every year, and the annual election period is when those changes are actually able to be acted upon. And this year is going to be a little bit unique in that there are some things that have happened that are going to cause a little bit more, uh, shall we say, disruption in the market. Um, so today's podcast is really about the Inflation Reduction Act and how it's going to affect Medicare benefits. For y'all that don't know about the Inflation Reduction Act, it was passed in 2022, and it was supposed to help reduce inflation. We're going to remain silent on whether that's actually happened or not. But the issue was is that they were going to reduce the federal budget deficit. They were going to invest in domestic energy production, and they were going to do a whole bunch of stuff for clean energy. Well, also tucked inside that bill was a lowering of prescription drug prices. And that's what directly affects us. And these cost controls on prescriptions go into effect for plan year 2025. And basically, the law says that no individual can have a total drug cost of more than $2,000 out of pocket in a year. And the issue there is how it's going to be accomplished because it sounds great. Uh, but Medicare supplement owners that have drug coverage separate from their supplement and the vast majority of Medicare Advantage beneficiaries are going to see significant changes in 2025. And right now, these carriers are scrambling, trying to figure out exactly how they're going to deal with the ramifications of this law. And we're just in a wait and see right now. But I wanted to bring this to you so you could actually hear a little bit about the reasons why this is happening and why I don't want you to be tremendously shocked when you start seeing some changes for next year. We do believe that the prescription drug market itself, that is going to be the biggest disruption, and I'll explain why in just a minute. But over the last several years, we've seen a lot of these prescription drug plans come in with very low premiums. I was working with a client over in Texas recently, and there is a plan. She doesn't have any drugs that she's on. She just needs a plan as a placeholder, 50 cents a month for that plan. Um, we've seen a lot of $10, $12, $13 plans in our markets over the last couple of years. And that that's going to be going away. And the reason for that is because the out-of-pocket maximum for the donut hole has always been somewhere. It increased every year, but it's been $7,000, $8,000 over the last couple of years. Now that is not an exact true customer out-of-pocket max. That also counts for the 50 or so percent subsidy that the drug companies are responsible for while you're in that coverage gap or donut hole. However, you're still probably looking at somewhere around a $4,500, $5,000 out of pocket, true out of pocket to the consumer maximum on those drugs, and now they're wanting to reduce it to $2,000. One of the criteria for drug plans and Medicare Advantage plans themselves is they have to be profitable. And the government coming in and saying that they are going to have this lower out of pocket maximum, well, that money's got to come from somewhere. It's not going to come from the government to cover those costs. It's going to come from the plans themselves. And so the plans themselves are going to have to use some sort of a combination of increasing deductibles or fully implementing deductibles, because there's a lot of drug plans that don't have deductibles for certain medications. So you're probably going to see more deductible focus. You're also going to see copays that are higher. And then, premiums are going to be the issue too. So those are the three basic ways that a drug plan has to control this. And because they're kind of stuck between a rock and a hard place, we're going to have to wait and see exactly how they do that. But those are the three mechanisms that they really have to do that on. Um, you know, it's not only the Medicare Part D plans, Medicare Advantage plans are going to have an impact by this as well. The difference is that Medicare Advantage plans have more variables that they can try to manipulate to keep those costs to a minimum. Um, Now, they're going to have some change in their landscape. They're going to have some disruption as well. But they have the medical side of this and the extra benefits side of this that they can actually tap into to moderate those costs a little bit. So, what you'll probably see in the Medicare Advantage landscape is not only the same three things that we talked about on the prescription drug side, but you're also going to see maybe a reduction in extra benefits. You might see premiums on plans that have never had a premium associated with them before. You might see higher doctor's office copays. You might see a deductible put on those plans. You might see higher hospitalization copays. It is just going to, it is a wait and see right now because we really don't know what these carriers are doing and they're scrambling. And so I think it's important to understand that this is coming. Um, you know, with the way that inflation has impacted all of our expenses, whether it's gas and food and housing and everything else in our world, it's important for us to recognize that doctors and the Medicare system, the healthcare system is not immune to that. And if you think about it, that every cotton swab and every band-aid, every syringe, every utility payment and rent payment and wage payment has increased over the last couple of years, sometimes very significantly. All of those costs have to be passed on to the consumer. And because those costs are passed on to the consumer, we will see that in increases in Medicare supplement premiums. And one of the mechanisms for that is in most areas, unless you're in a very high population urban environment, you probably have never dealt with a balance bill situation. But Medicare supplements can balance bill you for up to 15% of the cost of a procedure. I think that you might start seeing some more of these doctors actually utilizing that inside the Medicare, original Medicare with a Medicare supplement situation. And when that happens, what you're going to see is you're going to see an increased cost to the Medicare supplement carriers, and they're going to have to deal with that cost somehow. And if they've got a, 5, 10, 15% increase in their cost of actual care because of that, I think we'll see the premiums rise accordingly. And so it's an important thing to recognize that what has happened in our society over the last several years with this inflation, it might take it a little while to actually get to us in this form, but it is coming in this form and it is something that is happening. And so I wouldn't be surprised that over the next couple of years, we see a 15 to 30% increase in Medicare supplement premiums as well. Um, Now, the question is, what do you do? At this point in time, there's really nothing we can do. We're bringing this information to you just so you know that these issues are out there on the table. We don't know details. And because of that, we can't make any decisions. Just know that it's a good time to make contact with your agent. And if you don't have an agent, you need to get one. And you need to get a local agent that understands your market, your needs, your budget, and things of that nature. Um, if you don't have that kind of relationship, we would love to have an opportunity to talk to you here at 318 Insurance. Um, we've got agents mostly in our area, but we have some relationships, and they might not be contracted with us. But if you live in a place that we don't have agents involved in, we might be able to find you a good agent that can help you through these things. We've got relationships with other agencies nationwide, And with a lot of the carriers that we deal with, we can always get you in touch with somebody that should be able to help you as well. But this is a good time to have that conversation. And that conversation needs to be, hey, I want to be on the radar knowing what's going on when the time comes that we know what the details are. And that will be in the next couple of months. We technically can't talk about these things until October 1st. But getting on a schedule so that October 3rd or October 5th, you've actually got an appointment with an agent, that's an important thing that you're going to be doing. I will tell you that I think the agent force is going to be very busy explaining all these things as much as we possibly can over those 54 days of chaos, we call it, with regards to annual election period, October 15th to December 7th. And we want to be able to have the ability to communicate with everybody that we need to communicate with. So if you do need to contact us, feel free to do that. Our number here at 318 Insurance is 318-629-3777. Or you can look us up at 318insurance.com. That's our website. The biggest thing that I want to stress is this is not a time to panic, but it's a time to prepare. So take this advice, realize that this is going to be an opportunity for us to have some meaningful conversations over the next several months and make connection with that trusted agent that you have. God bless. See you next time.